This video is the fifth and the last on the series of diabetes. If you missed the first 4 videos, please scroll down to the chat below and I have attached the links to the first 4 videos. Hi everyone, welcome to Evolve 101 Health Talks with Dr. Yembe. In these videos, I bring you information that you can use at home to improve your health and your well-being. That said, the information that I give you is not a substitute for your medical care provider's recommendations. This video is the fifth and the last on the series of diabetes. If you missed the first 4 videos, please scroll down to the chat below and I have attached the links to the first 4 videos. This video number 5, we will be addressing several questions that came up as a result of the information that I shared in the previous 4 videos. I want to take this opportunity to thank you for following me and encouraging me as I bring you this information. So the first question that I received on diabetes is that, what is diabetes? That was the first question. So diabetes is a disease that occurs as a result of high blood sugar. So what that means is that the sugar or glucose circulating in your bloodstream is higher than normal. So that's the hallmark of diabetes. There are 2 types of diabetes, type 1 and type 2. For the purposes of this video, we are really talking more about type 2 diabetes here, but just for your information, type 1 diabetes mainly occurs in children because of a deficiency or a lack of insulin, and insulin is the hormone that breaks down the blood sugar. So these children, when they don't have enough insulin, their blood sugars are high, so they are treated with insulin, and that is type 1 diabetes. Now, most adults, and some children who are really obese, but most adults develop type 2 diabetes. That is the one that is diagnosed in adulthood as you are older. Again, the hallmark of diabetes is high blood sugar that is circulating inside our body. So you can imagine your blood sugar is high, it's going through your brain, through your eyes, through your heart, your stomach, through all your organs. In addition to that, through your blood vessels, your fingers, your toes. So it causes a lot of damage. That's the reason why it's very important that if you are diagnosed with diabetes, you want to work hard to keep your blood sugar controlled. By controlled, I mean to keep your blood sugars acceptable at the number where your doctor says it should be. But just for your reference, any random blood sugar, meaning that regardless of when you eat, if your blood sugar is 200 and above, then we start to suspect that you are diabetic. Go to the doctor. Please go to the doctor and get checked if you think you may be diabetic. Now, question number 2 is, I am not overweight, so why am I diabetic? That's a very good question. Now, diabetes type 2 comes about because of risk factors. Yes, obesity and being overweight is a risk factor for diabetes, but not all diabetics are overweight. Other risk factors include your genetics. Simply, your genes can put you at risk of becoming diabetic. If you have a positive family history, meaning that if your father, your mother, brother, or sister are diabetic, then you have a higher risk of becoming diabetic also. Now, your lifestyle, if you are very sedentary, meaning if you don't move around a lot, if you do not exercise, then you have a higher risk of becoming diabetic, whether you're obese or not. Another risk factor for diabetes is just simply eating too many sugars. Now, when you consume too many sugars in your diet, in what you drink like sodas, juices, or the things you eat like cakes, cookies, junk foods, all those things, yes, put us at higher risk of becoming diabetic. But you don't have to be overweight to become a diabetic. Your risk could be in your diet. There are some other risk factors like some medical conditions and some medicines. There are some vitamins even, like vitamin B3 is the biggest one. It can put you at risk of becoming diabetic. Other risk factors, other medications that put you at risk are medicines for seizures. Some medicines for mental problems can put you at risk of becoming diabetic. Other medicines, the biggest one we know is prednisone. Prednisone is a medication that is used for other things that cause inflammation, like for arthritis or for asthma and different diseases like that. So if you take prednisone for too long, because you have to take it for other illnesses, then you can become diabetic because that medicine can cause a complication of high blood sugar. So again, bottom line, you do not have to be overweight to become diabetic. Of course, being overweight or obese is a risk factor for becoming diabetic, but we do have some diabetics who are not obese. The third question that I got is, I am diabetic. My blood pressure keeps going up. Is my blood pressure going up because I'm diabetic? That's a very good question. Now, I'm not aware that diabetes on its own can cause high blood pressure. But what I do know is that the risk factors for becoming diabetic are, some of them are the same as the risk of becoming hypertensive. So we do see diabetics, most of them are hypertensive as well. So the risk factors for hypertension are being overweight or obese, having that positive family history, your diet, being sedentary. See how diabetes and hypertension can go hand in hand. Now that said, we do have blood pressure goals for those of you who are diabetics, meaning that if you are diabetic, you have to keep your blood pressure controlled. Otherwise, you have an even bigger risk of having a heart attack or a stroke. So what are the goal blood pressures? Your blood pressures have two numbers, one on the top and one on the bottom. The top number is called systolic and the bottom number is called diastolic. But those are just fancy terms. Listen, when you are diabetic, we want your top number to be between 125 and 130. Some people even say your blood top number should be between 120 and 130. Your bottom number should be less than 80, and this reduces your risk of developing major complications like heart attacks or strokes. Okay, let's look for the next question here. This is really a very good question. Someone said, I am diabetic and I went to the doctor and I was told that I had a heart attack, but I never experienced any pain from a heart attack, so I don't believe the doctor. Okay, so let's talk about that. Remember, we said diabetes is a condition where you have this high blood sugar circulating through your body from head to toe. On the inside, it also, so because of that, when your blood sugars are too high for too long, it causes a lot of damage to your eyes, to your heart, to your stomach, to your kidneys, to your blood vessels, and your nerves, meaning your sensation. Remember how we said numbness? Go to video number 1. We talked about things like numbness, so lack or reduced sensation. You try to touch something, you feel like your fingers are cotton. You can't really feel well when you try to touch something. You have pins and needles running through your fingers. That is because the high blood sugar can damage your nerves. And the same way that you develop numbness, that is, you don't have good feeling in your fingers and your toes, that's the same way you can lose the feeling around your heart also. So some diabetics have actually what we call a silent heart attack, meaning you did not have that big crushing pain. You may have had some other symptoms like shortness of breath, or you just felt tired, or you felt like your heart was racing, you started to get dizzy for no reason. My bottom line is, if you don't feel well, something serious could be wrong. You want to get checked, especially when you have a condition like diabetes, because the symptoms are so different from everyone. And to answer your question, yes, diabetics can have heart attacks without any chest pain. So the next question that I got, this was really a very interesting one, and this is our last question. If you have any more questions, please put those in the chat and I will be happy to answer the questions in the chat of this video. Now, the last question that I got is that I am snoring loudly. Is it because of my diabetes? Somebody said that the wife told them they snore loudly. Okay. So this is a condition that we need to pay attention to. It's not related or not caused by diabetes, but again, the risk factors are the same. You know someone who snores, they snore so loudly, then it seems like at a certain point they stop snoring altogether, and then they cough or sputter or do something, and then they start breathing again, and then the snoring gets louder and louder and louder, and then it stops, and then they cough or they do something, and then they start sleeping again, and then they start snoring again, louder and louder and louder, and that snoring stops, and the cycle goes on and on and on. Some of these people even wake themselves up when they're snoring, or they stop breathing, then some wake up and then go back to sleep. That is a condition that is most likely called sleep apnea. So apnea means lack of breathing, or your breathing stops. That is apnea, means I am not breathing. Sleep apnea means you stop breathing when you're sleeping. It's a very dangerous condition and it needs to be treated. So if your husband, wife, or partner, they are snoring loudly and they stop breathing in their sleep, get them checked for sleep apnea. Now, that said, I may be in Africa, I may be in a remote place where we don't have any tests like that for sleep apnea. We don't know anything like that. In fact, if you're from my village in Bot, where I live, we may have a health center that doesn't have this equipment, and even if they had the equipment and tested us, I may not even have the resources to go get this machine to sleep with to help me. So what can you do to help yourself, especially if you are overweight and you are snoring and you stop breathing while you are asleep? It is so important that you do everything to cut down your weight, to lose the weight, to reduce the amount of weight that you are carrying around. Sleep apnea is dangerous. That cycle of you breathe, you snore, you stop breathing, and then you breathe again, on and on and on, is dangerous, bad for your heart. You can have a stroke, a heart attack, and different things. So the number 1, 2, and 3 treatment for sleep apnea, if you don't have resources or you don't have a way to get the test, or if you had the test and you had sleep apnea, you just cannot afford the machine. Now is the time for you to work hard on weight reduction. Cut down your weight. Stop eating all these starches. Start exercising. Drink water instead of beer, instead of palm wine, instead of kwasha, instead of pamplemousse, or whatever you're drinking that is too sweet. Even fruit juice is not for you at this point if you are diabetic and your blood sugars are high. So what are my final thoughts on diabetes? My final thoughts are that, yes, the risk factors for diabetes includes some of them that are beyond our control. We cannot change our family history. We cannot change our genetics. Sometimes we may have other illnesses. We have to take some medicines that put us at risk of becoming diabetic. So those are factors beyond our control. They're not very many, but there's several other factors that are in our control. So things like your weight. You can lose weight, you can work on your weight. Things like your diet. Yes, you can work on your diet. Try to eat healthy, cut out the carbohydrates. Cut out the carbohydrates. That's really important. Start moving around, start exercising, get up and walk. Just tell yourself you will walk for 30 minutes to an hour every day. Those are things that are in your control. If you smoke, you want to stop smoking. If you drink alcohol, a heavy drinker, you want to work on weaning off. See how I said weaning off? You want to wean off and stop drinking alcohol, because these things damage your body, put you at higher risk of becoming diabetic. And if you were diabetic, then you can control these many risk factors here for complication. And then the ones that you cannot control, which are not very many, they stay there. But you have the ability to control your diabetes yourself. Last but not least, if you have been prescribed medications for diabetes, I can never say this enough. Please take your medicines as prescribed every single day. There are a few ways, especially for those of us in the remote areas. How can we, if I cannot read, then how do I know when to take my medicine? One thing that you can do, when you go to pick that bottle, ask the person who gave it to you, how do I take this medicine? Now, we know there's the sun for when we wake up and there's the moon for when we sleep. Very important. I have done the healthcare in my village, so I know if I want you to take this medicine in the morning, just draw the sun. It means one time. In the morning when you wake up, the sun is up, take your medicine. If your doctor says take it 2 times a day, write sun and moon on the bottle. Is just a drawing. That's it. Take it when the sun comes up and when the moon is here, meaning in the night, or when the sun goes down. Very important for you to take your medicine as it is prescribed. Okay? That's it for me. I hope this video gives you enough information to at least help improve your health and your well-being. If you have any questions for me, please type those in the chat box. I will be happy to come back and answer your questions. Lastly, if you have not subscribed to my channel, please hit the red subscribe button here below and hit that notification button, the notification bell, so that each time I put a video out like this, you get notified that I have released a video. Thank you, and I hope you achieve your health and wellness so that you can reach your God-given potential. Thank you.